everyone. I'm Li Ying, one of the Healthcare Scholarships Officers with Healthcare Scholarships and Talent. A warm welcome to Healthcare Scholarships Virtual Experience 2021. Okay, for some of you who have attended the earlier sessions, welcome again and thank you for joining us in this segment. We've come a long way since the start of our virtual events on 20th February. Starting today from 1st March to our last day on 3rd March, we have a series of activities lined up for our audience to learn more about the community care sector and how you can make a difference in the community. Our leaderboard is still ongoing and there are game sections for the participants to win attractive prizes such as Universal Studios Singapore One Day Pass, Disney Plus subscription, GrabFood vouchers, and many more. There are many ways to earn points, such as by attending programs, asking questions, and playing our daily games. Welcome to the future of community care. In this session, you will learn more about the purpose of work in community care, key innovations in care delivery to help our Singaporeans live and age well, as well as a diversity of exposure and experience that one can look forward in this fast-growing sector. Before we begin, if you have any questions for our speaker, please feel free to type your questions into the Q&A box. If you see any questions that you are interested in being answered, please upvote the questions. Without further ado, I shall invite Mr. Tan Kwang Cheak, CEO of Agency for Integrated Care AIC, to kickstart the 3-day community care feature. Kwang Cheak, please.
Thank you so much, Li Ying. Good morning, everybody. I want to first thank you for your time with us this morning and also joining me for this particular session. As mentioned, I'm Kwang Cheak. Most people call me KC. I'm the CEO of the Agency for Integrated Care. I wanted to spend a bit of time this morning to share with you what we do and what we focus on in community care. But more importantly, how do we contribute to our Singaporeans as well as our seniors being able to live well and age gracefully in Singapore? And more importantly, looking forward as well, how are we preparing to transform care? And how do we do so, in terms of being able to cater to the needs and the aspiration of our Singaporeans moving forward? As mentioned by Li Ying, if you do have questions along the way, I would like to encourage you and love to hear in terms of your questions, your thoughts. I do have questions later on towards the end of my presentation, where I'll use Pigeonhole to tap on your views, your suggestion, and your aspiration for community care. Okay, and if you are interested to join us, we do have dedicated sessions to talk about our scholarship for the community care sector, and that is scheduled on the 6th as well as the 13th of March. And that's when I also hope to meet you in smaller group, of course, with safe management measures to talk through more of your interests and why you want to consider community care in terms of the scholarship and the future career that you'll take up. Okay, but let me start off by first, setting the context. And if I can move on to the next slide, it is about community care. And while you think about, scholarships for public health care as a whole, in terms of what we do to care for Singaporeans and our senior, I want to share a little bit, firstly, in terms of our purpose and our purpose of work in community care. And secondly, I will share a bit in terms of the growth of the community care sector and why the work we do continues and will be even more important and critical going forward for Singapore and Singaporeans. Lastly, I'll talk a little bit about the future for community care and more importantly, I feel, what it means to you and why you should consider your future to be with the community care sector. If I can move on to the next slide, it is the case that we have been grappling with the current ongoing COVID-19 pandemic. If I can move on to the next slide, Lynn. Yes, and that has, I think, been our journey through the challenges, the previous slide, please, through the challenges of COVID-19. And I know we have all, had to make adjustments, and the situation has huge impact on us, over the last 12 months. And now with vaccination actually ongoing, the light is at the end of the tunnel. But while we deal with the immediate challenges, and that is for COVID-19, as well as pandemic in general, it is the case that we are also grappling with 3 key longer-term challenges for our society and also globally. And that is in terms of climate change, in terms of the impact of digitalization and technology, and thirdly, and to me, most importantly, the impact of aging. And this what has been called the three tsunami, including the pandemic that before. But that's been something that Singapore has been, planning ahead on, and looking to actually stay ahead on going forward for us as a country. And if I zoom into, the area of healthcare and aging, and the next slide highlights actually our key challenges. And I think you have read about it. You have also seen or even discussed it, with, your teachers within your classes, or even with your friends. And it is the case going forward. And now we do face the challenges of aging population, which means that, more of us would need care and support, and not just within the hospital, but out at home in the communities where we are. And the trend is that by 2030, 1 in 4 of us, and myself included, will be above 65. And that also means that in terms of impact of what we need to put in place to provide the care and support for them, as well as the impact of chronic conditions going forward because of the affluent lifestyles that we have, will continue to impact on our healthcare system. On the other hand, we do face slower workforce growth because our overall population is reducing, and therefore the working population is declining. And therefore, we really need to not just look at productivity, but also look at where do we focus our manpower on as a system to provide the care out to our Singaporeans. And we need to continue to ensure sustainability in our healthcare system. But when I talk about tsunami and challenges going ahead, I thought it is also important for us to focus on what is at the center of all this that we are looking after. And the next slide highlights, I think, the core of the issue, which to me is not just about how are we going to cope with the challenges of aging population, the challenges within the healthcare system. If we put our Singaporeans and our seniors at the center of it, I think the key question for us is how do we fulfill not just the needs, but also the aspiration of our seniors going forward. And not just about challenges, but how do we help them to age with dignity, with the life that they would like to have, with autonomy, and with the choices that they would like to make at that stage in their life. And it is about aging as a positive force. And while I put on the slide in terms of some of the aspirations of our senior, and these are real examples, whether in Singapore or overseas, I think it is not the case that we expect everybody to want to climb Everest Base Camp or to be bodybuilders. But it is about asking the question of what would our seniors like to have? How would they like to age? With their family, with their loved ones, with independence, with dignity, with choice. And to us, that's about aging well, about aging gracefully, and and looking at aging as a positive force. So that's the narrative and the mindset change that we want to continue to drive about aging going forward in AIC and together with our partners. And if this is the purpose of why we exist, within the AIC, and then also what we do with our partners within the community care sector, I think the focus then is about how do we deal with the challenges going forward? How do we fulfill the aspiration of our senior with our partners in the sector? If I can move on to the next slide. And so I want to talk a little bit in the second part about growth within the community care sector. And the next slide, if I can, will then highlight what AIC focuses on firstly. And we do want to build a vibrant care community, enabling our people, our Singaporeans and seniors to live well and age gracefully. And it is about, firstly, as I mentioned, looking at how do we empower our seniors and our clients. And we deliberately use the word empowerment because it's about providing choices, autonomy, dignity, and allowing them to live their life as they would, as far as possible. But to do so, we need to be able to transform the care community. That's where we work with our partners, with our service providers that are absolutely critical, providing the care, the program, and the services out on the ground in the community to our clients and our seniors, as well as other stakeholders around, including organization, grassroots, schools, religious-based organization as well that can collectively help us form this care community. And so, the next slide will then highlight, beyond what AIC does, we do work very closely with our community care sector. And our key partners are actually in these following three broad areas. Firstly, in terms of the residential-based care, and this ranges from the community hospitals that provides rehab as well as subacute care, for short periods of time out of the hospitals, preparing them back to home as part of their care journey. And this also includes nursing home that provides longer term care for those who are really in need of more continuous care. And our partners are also, in the areas of center-based care. They run our dementia day care centers, our senior activity centers, senior care centers, as well as day hospice. And this, provides care for those who are still ambulant, who have certain caregiver support. And the last part is really home-based care. We also have partners that focuses and provides, home care in terms of home medical, home nursing, home personal care, as well as home hospice. And this typically caters to those who are more homebound and have some caregiver support, but who need this care and support to complement those. And when we talk about the community care sector and our scholarship that we offer for you to consider, we are really talking about our partners that are currently doing important and great work in these areas, and for you to consider your future with them. And particularly during the COVID-19 period, we have seen, their important and extremely, fantastic work in terms of keeping our clients, our residents, and our seniors safe, whether it's within the nursing home, whether it's within the senior care centers, or whether it is those who are at home to be able to provide the care and support out to where they are. And it has been extremely challenging, but I think they've done extremely well as well. And we continue as AIC to support them and partner them closely. If I can, move on to the next slide, it is also about supporting the overall strategic objective that we seek to achieve within the healthcare and the social care system. And so, within the ministries, the Ministry of Health context, they have this strategic plan that focuses on three beyonds, or what we call three strategic shifts: beyond healthcare to health, beyond hospital to community, and beyond quality to value. And so what we do and focus on together with our partners in the community care sector contributes significantly and are quite integral to the strategic shift in terms of moving beyond the healthcare to health. And so we work very hard, to help to keep our clients, our senior, healthy and focusing on active aging, engagement, befriending, to keep them at home in the community where they like to be. We also focus and support very closely in terms of the strategic shift beyond hospital to community. And that's where, beyond hospital to community, I apologize. And that's where, it reflects the emphasis and so also the focus of the Ministry of Health in how the healthcare system needs to evolve. And it is really not just about the acute hospitals or the specialty centers, within our three public healthcare clusters. It is extremely important to also focus on the community care sector that provides the care and support out in the community and at home. And that's where the strategic focus is driving us, and that's where we are working very, very hard on. At the end of the day, if I can move on to the next slide, it is about building, a community care ecosystem that can enable, empower, and help our seniors to be able to live well and age well in the community and at home. And if you ask, our senior and for those loved ones who are close to you, I would guarantee that almost everyone will say where they want to be is really to be at home together with their families and loved ones. And so our ecosystem is designed to support that aspiration as far as possible, while acknowledging that there may be some that need a more continuous care at our residential facility. And how we do so is by these three pillars that we are developing and putting in place out in the community. Firstly, through touch, where we will engage, outreach, and touch our seniors through the Silver Generation Office that's part of AIC. And there are volunteers as well as our staff. We have 3,000 volunteers that do outreach, and they go out to ensure that they communicate the policies, but not only that, we understand the needs of the senior and be able to proactively match them to services program, whether it's active aging, befriending or care and support when the need arises, and rather than wait for them to come to us, at one of our healthcare institution, polyclinic or counters. But the touch in itself is not sufficient. We recognize that we also need to be able to hold them, and this is through our partners out in the community, be it those running our senior care centers, be it those stakeholders like grassroots organization and leaders. They'll be able to help us hold our seniors in the community where they are, and to continuously engage and empower and help them. And lastly is the help pillar, where we provide the care and support for those who need them, whether it's those with health and social needs, those who actually may need certain programs and services to help them to stay active or to be able to maintain their health. And so, this is what we do, and the mapping on the right, just to show you in terms of the data that we have been able to pool, but more importantly, to structure the ecosystem around together with our partners. And the next slide, just briefly, in terms of being able to cater to our seniors, is then about helping them to stay active, helping to ensure that they are not socially isolated, for them staying alone, who may not have the family or the social support. We want to be able to connect them to befriending services, and to provide the care and support services for those who are more frail, more vulnerable. Increasingly as well, we are involved and we are supporting the effort to include our seniors in the digital trust for Singapore. And that's where the last part, which is about digital adoption, comes in. We partner the SDO very strongly, the digital office very strongly to do so. If I can as well, within the community care sector, there are various innovation apart at the system level, whether it's in terms of using technology, whether it's in terms of using new approaches like virtual reality, whether it's in terms of trying out new care models. This can be part of a journey together with us. There's tremendous area that we can learn from, whether it's locally, overseas, can be introduced in terms of innovation, but most importantly, to be able to impact on the care, support, and empowerment that we provide out to our seniors and our clients. If I can, I've spoken quite a bit about our purpose. Why are we here? Together with our Comcare sector, spoken about the growth within, and what we are actually looking at and putting in place to cater to and empower our clients, our seniors. I think the last part, I want to talk a little bit about the future in the remaining time. But perhaps having heard, I think so far, in terms of our purpose and our growth, and perhaps I wanted you to think a little bit about what do you hope to see in the future of community care. That's why I would love to hear from you a little bit more. If you can help me a bit, we have created a pigeonhole. Pigeonhole, if you go to pigeonhole.at and you enter the passcode 010321, there is a question that I hope you could key in your thoughts about what you hope to see in the future of community care in Singapore. I mean, having heard and having experienced, for some of you in terms of what community care sector does, what would you hope to see in the future that we would like to co-create together with you, as well as our partners going forward? So if you can, help us a little bit, there'll be a word cloud that we'll show at the end. But if I can move on, we'll come back to this question. I think the question that I would like to put forth for you is not just about thinking about the future of community care, what we need to put in place, but why you would consider us in terms of thinking about not just about your scholarship, but also about your future career, future purpose of work, how you want to actually live out in terms of your impact and your purpose in life. And so, I'd like to offer you 4 reasons, in terms of why you should consider community care. Firstly, if you feel you have this inclination to care for others, and that's something that appeals to you, if you want to be part of a growing and evergreen sector, because the need grows, our sector continues to grow, innovate, and continues to want to focus to cater to the growing needs of our aging population. If you want to consider diverse career opportunities and exposure within the sector, within different career tracks. But lastly, and most importantly, if you want to make a real impact to the lives of Singaporeans and our seniors, then I think community care is right for you. And at the end, if I can end off, before we go back to the pigeonhole, it is not just about you and us and our partners in community care, but it is about Singapore and how we can collectively create a better society for Singapore. And to me, the integral part of that is about our cohesion, our inclusion, and how we help all Singaporeans live well and age gracefully. At the end, that's our contribution to our seniors, our Singaporeans, and Singapore as a nation, as a society. And so, thanks very much for listening to me. It is about, what we do. It is about our purpose, but more importantly, our impact. And I would like to, appeal to you in terms of thinking about us building a better Singapore and helping Singapore to be one of the best places to age in. So thank you so much for your time. Really appreciate, we'd love to hear your questions. I will show you a little bit in terms of what you would like to see in the future of community care. Continue to key in. If you can, in terms of your views on the future of community care, and I would love to also answer some of these questions as well. You might know as well, maybe if I can address it up front, it is about helping to build Singapore as one of the best places to age in. That is our vision. That's what we collectively work towards and work very hard towards together with our partners. But we also recognize that in terms of career development, in terms of salary competitiveness, in terms of us being able to offer you the value proposition, something that we're working very hard towards as well. You might, if you Google or checked a little bit further, we have made salary enhancements for our professionals and the sport care staff within the community care sector over the years. The last of which, was made and announced as part of the Committee of Supply debate back in March 2020. And if you're keeping track with the current budget debate in Parliament, you would have also heard the announcement by DPN Heng that the Ministry of Health will be looking to also make further enhancements to the salary levels of the healthcare professionals as well as the support staff within the healthcare system, which includes the clusters, the hospitals, as well as the community care sector. So that's something that's coming. If you hear out the announcement soon, you will hear more during the Ministry of Health's Committee of Supply debate that should be towards the end of this week. So we are looking at and putting in place, I think, the foundational pieces that are important to offer you the value proposition, including salary competitiveness. But not only that, I think offering you the career development prospects that we feel will be important. And more importantly, the impact that you can have caring for your senior, throughout, the last part of their life, which is, I think, what differentiates community care, say, from that of the care that's been provided through the hospital, because we do age with our seniors. We do help them through, as they go through their phase of life. And the phase of life through being healthy, and we want to keep them active and aging well. But if they do grow more frail, we also support them. And even towards the end of life, which happens to all of us. So end of life is also a very important area for community care. We want to enable our seniors to be able to live well as well as live, L-E-A-V-E, well as well. If I can later on, after this, there will be a session by Ren Zi. And I will encourage all of you to stay on as well. Ren Zi is one of our most important partners, and all partners are important, but they are really doing great work, not just within the community hospital that they run next to Tan Tock Seng in Novena, but also they run nursing homes in Ang Mo Kio, Bukit Batok, as well as Ang Mo Kio, Bukit Batok, and upcoming in Woodlands. And they also run other services like home care. Do talk to or listen to Ren Zi's talk, and I saw the comment about nursing homes. If you visit, and if you would like to, we will be happy to arrange visits to our facilities, be it nursing homes or the senior care centers. You know that we have been making improvements and steps towards creating the right conducive caring environment within our facility, particularly nursing homes. And while we have 77 now nursing homes and 2 inpatient hospitals in Singapore, I think we have made a significant step forward in terms of improving the environment. If you visit the newer homes, what we call build, operate, and lease homes, I think it is a lot closer to what we would like to see in terms of the care and the environment that we can provide Of course, we're also working with the existing facility that may be older. At the end, the yardstick is this: for those facilities that that we go to, we need to also be comfortable that our loved ones, if they go there, will also be comfortable as well. That's the yardstick that I use and my chairman use as well. Okay. Integration in healthcare cluster, definitely so. I think that's the important part, of what we do. How do we also help to integrate what we do in community care with primary care as well, with polyclinics as well as GPs, because there has been shifts and move towards, creating or supporting family physicians who should be able to care for the families. And then, in terms of how we then integrate that to the care at the hospital, so that, in terms of those who are being discharged out of hospitals, they are supported very strongly to be able to stay at home in the community. And for those who may need care support from the home and the community, the hospitals or the cluster can come in to support. But one last point, if I can, we're also working through the partnership between the clusters as well as our ComCare partners, because I think there's sharing, collaboration, expertise that can help us do better as a system as well. Okay, I've been told that I'm running out of time, but I really want to thank you. I should really have more time with you, and if you will allow me the time. But today, I think time is short. We'd love to see you, at our community care scholarship session on the 6th and the 30th of March. You can check out, I think, the Facebook page for more details. We'd love to see you there, because, we are going to have in-person sessions, and particularly if you're keen, you're interested, want to talk more, come and we can help you hopefully make the right decision for your future. If you have further questions, please do continue to key in. I will promise you, I will come back to you with our perspective, our views, but more importantly, our collective sort of thoughts about what we need to build for the future of community care. But most importantly, as I share with you, how do we help Singapore be one of the best places to reach? Thank you so much for your time. Hope to see you soon again, and also hope to see you, together with us in the community care sector. Thank you so much. Ling, please.
Okay, thank you, Casey, so much for sharing. Due to the interest of time, we don't have time for a Q&A, but like Casey mentioned, they will be having a scholarships information session, and you'll be able to sign up and join these activities to raise questions in person, as well as find out more about the community care scholarship as well as community nursing scholarship. And we also have upcoming events today and until Wednesday, where you can find out more about community care. So we will now take a short break before the next event at 11, Make a Difference in Community Care, Residential-Based Care with Renci Hospital. So just take a quick break and pop over to the next link to join us at the Renci Hospital session. Thank you.